All right, you're in pain, shoulder pain, you're trying to do the Olympic lifts, snatch, the jerk, it's bugging you, you're not sure what to do. And again, although we focus on weightlifting, this could be anything going on with that shoulder. You have a movement and it's really giving you some pain, sore, tight, achy, radiates down the arm. In this video, we're gonna dive into that and get you out of pain so you can have the best training possible. So, the description I gave for the shoulder pain was pretty generic, right? Sore, achy, tight. Well, what I wanted to do was I wanted to take this issue a bit deeper than just myself talking about the shoulder. So what I did was I went out and I looked for an expert, and that expert I found is Dr. Richard Olm. Now, Dr. Richard Olm works with athletes, coaches, physical therapists, chiropractors, all of these individuals through the dynamic neuromuscular stability, where he's an international instructor. So he travels the world teaching this stuff. And what I wanted to do is I wanted to go out to him and see, with all these athletes that he gets to work with, what are the top 2 shoulder issues that he sees, and is that something that we can take advantage of around that knowledge? Here's what he had to say about the top 2.
The two big areas that I see in the shoulder, particularly with the snatch and a little bit with the clean and jerk, the 2 big things that we see in dysfunction is, one is going to be their pec gets really, really tight. And both of these actually are from the shoulder blade getting a little bit more unstable. But when the shoulder blade's unstable, or there's a little bit of aggravation in the shoulder, the pec, which might be the pec major, the big muscle here, or even the pec minor, which is a smaller one underneath it, it will actually pull the shoulder forwards. And that's going to cause pain in the shoulder itself, because now when you go to receive the bar, instead of being able to have that shoulder, that glenoid, actually facing up and out, it's facing forwards. So you end up catching and receiving the bar at end range of external rotation, and that sort of tweaks or pinches the shoulder a lot. And then there's also a decent amount of actual shear forces. So if this is the shoulder blade, it should be facing up and out, so that when you receive the load, the bar and your arm are lined up and are going to push straight into the shoulder. If the shoulder's forwards, so if we're looking kind of from the top here, this arm actually kind of slides forwards a little bit. That pushes into a thing called your biceps tendon, and that is connected or tied in with the labrum. And a lot of the labral tears that we get, or biceps tendonitis, come from bad shoulder position at the receive, which is actually resulting from tight pecs, which is actually resulting from scapular instability. That's one.
Does that issue with your pec sound familiar? Now, this could be even more painful if you know that you work a lot of chest and you know that these are tight. However, if we're doing jobs, if we're sitting at desk and we're hunched over that computer, that absolutely can make this worse as well. So keep that in mind. Now, let's keep going.
The other one that also comes from scapular instability is going to be tightness in the posterior part of your rotator cuff. So the rotator cuff has 4 muscles: the subscapularis, which is underneath, the supraspinatus, which is on the top, and then the infraspinatus and the teres minor, which are all kind of on the back. When the shoulder blade itself is unstable, a lot of times the rotator cuff will become tight, really in an attempt to hold the shoulder into position. And when that guy becomes tight, you actually start losing range of motion here. And again, it will kind of squeeze the shoulder forwards into that biceps tendon.
Okay, he's talking a lot of muscles. That might be going over your head, no pun intended, with the shoulder issue. However, that was corny. I get it. I'm sorry. But however, okay, it was really corny. It's got me laughing. Okay. Now, don't get intimidated by, the muscle talk and where he's going. Just know that because we don't have control of that shoulder, or our nervous system is like, hey, I can't control the shoulder during that movement that we're trying to do. Let's again use the snatch as an example. muscles are tightening up to try to give us control of that joint. So just keep that in mind. Don't get lost in the muscles and which muscles to a point where you're like, I don't know what they're saying, I don't know what to do. Now, where do we go from here? What are the symptoms? So what symptoms, what kind of pain do we get from this? What's going on? So let's dive into that.
In either case, you're basically getting the arm bone isn't staying in the socket very well, and that causes aggravation, maybe a sharp pain, maybe achiness. When it's really bad, it might actually radiate down into your arm. But all of those are actually coming from scapular instability. So that's why the stability portion to this to function is so important. It's easy to think of it as like, oh, I'll just stretch my pecs out, or I'll just stretch my rotator cuff out, and I'm good to go. If you don't address the underlying stability issue, they'll just keep coming back.
All right, guys, he just slapped us with some truth. I'm not sure if you heard that, but we can't just mobilize, we can't just stretch it and then, okay, get into the workout and the shoulder be okay. Say the pain went away, it's gonna come back. He's mentioned the word stability a lot, and I had to ask him because I, just like you, sitting there, probably like, well, what the heck does that even mean? So the question next is, what in the world is stability?
So stability is tough. Stability is one that is about control. And I say control because you have rigidity, which would be the ability to basically maintain the same exact position. I could try to hold in this position and make the shoulder joint rigid. Well, we obviously need to be incredibly mobile in the snatch. It's not just about making the body rigid. If it were rigid, you could only really stay in one position. Stability is about control. And that means that no matter what position the shoulder is in, or whether you're turning the bar over or obviously receiving the load, you're able to maintain good positioning of the shoulder, or any joint for that matter, as you go through a movement. So stability is not just about holding one position, like I would say with rigidity. It's about being able to maintain good position or maintain control of a joint as it goes through movement. It actually gets very complex. It's not just about the muscles around that joint. It's those muscles that connect to those muscles and the muscles that connect to those muscles, tying all the way back into the trunk, even down into the legs. There's also some biomechanical factors into it. Obviously the more stable a joint is, they tend to have less range of motion. The more mobile a joint is, the more difficult it is to actually maintain stability. And that's because, for the most part, stability and mobility are inversely related. So when I have the structural components of a joint, if there's a lot of them, like the hip has a big, deep socket, so it has a lot of actual structural stability. That means that the amount of muscular stability isn't quite as important as it is in the shoulder, whose socket is much more shallow. So in the shoulder, we don't have the same contribution of static structures like bone and labrum or meniscus or something contributing to the stability, which now puts a lot of that load onto the dynamic structures. So the rotator cuff, the pec, the lat, the trap, all of these muscles have to work together to keep the joint stable or controlled in the right position.
Wow. Okay. Where do we go from here? Okay, so now we've gotten to hear two common shoulder issues. This and some pieces of those might relate to you. I really hope they do. Now we understand stability at a deeper level. Where do we go? The next step is getting you out of pain. And I know you're not gonna like to hear this. I know it. But that means stop doing the things that irritate the shoulder. Again, let's go back to that snatch as an example. If the snatch, when you're turning over overhead, is irritating the shoulder, then we have to back it down. Don't worry, it's not gonna destroy your gains, destroy your training. We have to give it an opportunity to take the swelling down, get it out of pain. So take those snatches and let's start working some pulls. Let's start working accessories that we can build up from. That's taken care of. Now, although Dr. Olm said, mobility and stretching just isn't the absolute fix, what we can do here is we can get those tight muscles turned off So the other muscles have an opportunity to start working, and that's that stability piece. So if your pecs feel like a tight rope, we have to get in there and start to open them up. If you're not sure what muscle's tight, at this point, it could be great to get some guidance, whether that's a coach you trust that understands what's going on at a deeper level. Maybe it's a massage therapist. Maybe it's a chiropractor. Maybe it's a physical therapist. Get the help you need. At this point, it can absolutely, I always make this reference, like putting lighter fluid on a fire you're trying to start in the rain. It's gonna give you a boost. It's gonna help you start to get that turned off. And after that, it's time to go after the stability. And that's what's going to be in the next video, okay? So the next video, we're gonna dive deeper into that, but it's up to you here. So this is where I need your help. Tell me in the comments below about some of the shoulder issues going on. What are you facing? What exercises are causing it? How long's it been? Give me some of these examples, and we're going to pull some more information together around, all right, so we have an issue going on, we've lowered the pain, we've gone away from doing those type of movements that irritate it. What can I do now so this doesn't just come back? So get yourself out of pain, and good luck.